Good evening, team. My voice is audible to everyone?
Yes, it's audible. Good evening.
Okay. Yeah, good evening. So just stay online. I'm going to be refresh the teams due to sharing my screen. So just you can stay on the line. It will be reconnected once again. If the teams are reconnected, please join with the again. Join again. Okay.
Okay.
Okay. So everyone can able to see my screen, team. Everyone can able to see my screen. Screen is visible to everyone.
Yes.
Yes,
Okay,
it's
fine. So I hope most of the people are joined. We'll wait for 2 more minutes. Sorry for the delay. So we'll give 2 more minutes for 8:35. We'll start. Okay. Okay, so thank you for your patience. I hope everyone has joined the session. Okay, so first of all, I'll introduce myself. This is Jagdish. I have 8 years plus experience in that medical coding field. So I'm going to be taking care of your complete medical coding training, inpatient training, and the career guidance and the placements, whatever the queries is there, I'm going to be handling to you. So I'm managing this complete training thing. So I'm working as a training team lead in this institute. So I'm going to be taking care of you. So whatever the issues happen related to the training, you people can able to connect it with me. And whatever the queries you have related to the placements and the thing is, I can able to assist you along with our HR team. So I'm Jagdish. My number was mentioned here. So if you're having any doubts or any questions, you people can able to connect with me in this thing. Okay, so just a intro I given that. So our institute AGS Coding Tech, now it is converted into Jvages Healthcare Private Limited because of we got a projects. So we are doing the projects as well along with the training. We started our careers in the training institute, but later it was slowly developed. And after last year mid, we started our own projects in inpatient coding and as well as SCC projects. So along with both the projects are running in that Delhi and Chennai, both the locations it is running. In Hyderabad, we are locating as a training institutes. So we are given the training to the candidates and we are placing in the multiple companies as well. So this is our short thing. I hope everyone knows about the name of AGS Coding Tech. So now the name of AGS Coding Tech was converted into Jvages Healthcare Private Limited, and as well as we are acquiring in that two companies also, Texas Health, so that you people are aware of that already. So that also we are acquired. Now we are in the leading training institute in that market. So now we are joining here. Most of the candidates are fresher and most of the candidates are experienced. Both the candidates are there, right? Yes. Both the candidates are there.
Yes. Yes.
So may I
I have
know?
12 experience.
Yes, sir. Yes, sir.
So may I know if you are a fresher, just mention as a fresher. Just if you are experienced, just mention as a experience. I can able to know how many people are experienced and how many people are freshers. I can able to understand that to clarify on that. Okay, so just you can mention that, just mention a convo. And today demo, it will take more than 1 to 1.5 hours. End of the session, I'm going to give you the premium application access. Premium application access means it contains all the study materials. It contains all the study materials. I'm going to give you free of cost up to 7 days. You can able to utilize because once you join our institute, later there is no study material, there is no proper follow, there is no things is there, this one is not there, that one is not there, there is no application, there is no assessments. These kind of issues the people are facing if you are joining in some other institutes. But in this institute, what we are giving, initial day, you are paying or not, whatever it is, you can experience our application, experience our mobile application, how we are doing the classes, what are all the materials we are providing you, what are all the study materials we are given to you, and what are all the assessments we are going to be providing you. 7 days you can able to use unlimited access. There is no restrictions, nothing is there. You can able to use it. After 7 days, if you felt it is worthy, you are going to be learn something else new, you can continue the training. In case if you don't want to know, it is not that much up to the mark means your access will be revoked. That is fine. Okay, so that's what. Please wait until end of the session. End of the session, I can able to provide your application access as well. It is clear, team. Mobile application access. It will be work in iOS and Android as well. It will be working in iOS and as well as Android application also. You can able to use it. Okay. So the next will come up with that our today core training is inpatient coding. Okay, so today our core training demo is inpatient coding. We are doing multiple certifications. We are doing multiple trainings, multiple cross trainings, ED training, E&M training, HCC training, outpatient specialty, surgery training, IP denials training. This and are all the trainings we are doing. Now, this is the demo was scheduled for inpatient coding, Ipdrg. That is the training we scheduled today. Okay, so fresher or experience. So experience already you people are working in some other companies. So now you people are planning to Ipdrg. So just share your experience. Why you people are choose other specialty already you people are working. Why you people are shifting one specialty to another specialty. May I know the reason behind that. Later I will explain about the freshers. Upgrading. Super. You need to upgrade yourself. Then salary wise, yes. Salary wise, we can able to get it high compared to other specialties. We can get it high. Then
Inpatient will be get high salary like the urgent surgery, but remaining also will get, but less salary will be HCC department only.
Yeah, yes. So a lot of things we can able to get it like so how we can able to say in the future easy growth, right? This and are all the things we can able to get it. Yes, AI proof. Yes. Yes, this is also one of the topic we are going to be discuss about like AI. Ipdrg have more opportunities, upgrade and salary experience. Okay. So that is the reason you people are going to be shifting one specialty to another specialty. And second thing is if you are a fresher, in your mind, your thought will be, I hope you people search lot of institutes, you go somewhere else, you are searching with that. Wherever you people went, the people will suggest you to do any one of the certification. Correct? Whatever the institutes you are going there, they will ask you to do any one of the certification. It may be CPC, it may be CCS, whatever the certifications it may they recommend. But before itself, you should be analysis the market. Before 2023 and 24, there is no issues. Whatever the certifications you have, you can enter into the medical coding. But as of now, lot of categories, lot of specialties, and the client's expectations and the company expectations are completely different. So before you are going to take any one of the medical coding training or certification training, you should be think like, I want to become a which specialty coder. For example, after senior college, you need to be choosing like after 12th or senior college, you people are choosing, right? I'm going to do BSc, I'm going to do BE like that, correct? You people are choosing in your career. But after that, which one is specific? You are choosing, right? I'm going to do BE, I'm going to do lecturer, whatever the thing you people are going to do, planning that. Same like that, once you are completed your license graduate, later you are entering into the medical coding and you are thinking it is my future now. You should think in here also, you should decide which coder you want to do. Inpatient coder, outpatient coder. Inpatient coding, lot of different thing is there. Outpatient coding, different specialities are there. So that and all you people need to be differentiate. Okay, so that you people need to be a awareness. This is the awareness. So it's not randomly going to be joined the training, randomly completed the certifications, not like that. Because you people knows most of the experienced candidates facing the issue already they completed the CPC certification, but now they are doing CCS certifications for to move Ipdrg. Correct? Already you people spend some amount for CCS CPC certification. We don't know what is that we completed, right? For entering, we completed. Yes. So now again, we are struggling to complete one more certification to enter into the Ipdrg. Correct?
Hello?
Yes, ma.
I
Yes, it is
don't know,
okay.
sir. Actually,
Yeah, CPC eligible for the Ipdrg, right? Certification.
Yeah, I will be explained, completely explained. CPC is eligible, CCS is eligible, which one is valid, and both everything I will be explaining during the session. Okay, no worries.
Yeah.
Yeah, okay. So just I'm suggesting that how to choose your career. If you are already choose your career, we can able to move into inpatient coding. What are all the things is required? If you are a fresher, if you want to become a coder, coder is easy. But which specialty coder? You want to become an HCC specialty coder, ED coder, E&M coder, surgery coder, inpatient coder. Which one is growth? Which one this is, and how I can able to enter and how I can able to grow myself. So this and are all the things here we are going to be discuss. Okay, so completely here we are going to be discuss about like only inpatient coding growth, what is inpatient and how it was developed and what are all the things we need to be do and how to enter into the medical coding department in inpatient coding for both experience and fresher. That is the thing where we are going to be discussed. Okay. So first of all, basic thing, if you want to become a medical coder, what are all the things is more important? If you want to become a medical coder, if you want to choose the medical coding department, what is a basic skill you require? What is
anatomy.
a basic skill? Anatomy, yes. Anatomy is one of the most important thing you people need to be aware of that. Even though most of the experienced candidates also struggling to explain the anatomy and physiology in the interview sessions. We've seen that I'm taking that lot of companies interviews as well. And I'm doing that lot of companies assistants as well for the interviewing. And before I'm doing the mock interview for my candidates, they know very well about 5 years experience, 6 years experience. But whenever I'm asking to explain about what is the function of the left ventricle and right ventricle, the people unable to say, even though they have an experience. For fresher, it is very difficult. If I'm asking like digestive system also, the people are struggling to explain the digestive system. So if you want to become a medical coder, the first basic skill is anatomy and physiology. Correct? Anatomy and physiology. So if you want to become a medical coder, first thing is it's come to in your mind, you should know completely anatomy and physiology. You should know completely anatomy and physiology. It's not only from that anything. If you need to clear the interview itself, anatomy is more important because how the interviews patterns are scheduled now. The first skill is anatomy. Second skill is ICD. Third skill is procedural coding system. Fourth skill is communication skill. Fifth skill is your presence. Your presence. So that is the thing you people need to be aware of that. So first skill is anatomy and physiology. What is another skill we require? What is another skill we require?
Selecting the course.
Medical
Skill that is work orientation. I'm saying about if you want to become a coder, one is anatomy physiology compulsory you should know. Second thing is not apart from that ICD pieces. ICD pieces is specific thing.
medical
Analysis
terminology.
of
Medical terminology.
Medical terminology. Yes, medical terminology.
Yes.
Super. Medical terminology. Then one is medical terminology. Another thing,
And medicine use.
medicine names. Medicine names. If you are a pharmacology students, compulsory you people very well aware of that thing. But even though I'm facing that issue with the pharmacology, pharma students itself, they were very confusing about the medications. Yes,
Yes,
fine.
sir,
No
because
issues.
their medicine, their different guideline they follow, sir.
Yes. So which condition they are treating with the medication? So okay. So medications, medical terminologies like pharmacology. Then any other skill. One main thing is there. If you want to become a medical coder, this one is more important.
Basic computer skill. Basic computer.
No, computer skill is not mandatory for coders.
Speaking
Just
skill,
the system will be open.
communication
You need to open the software. Basic computer skill. Now everyone have the computer skill. Other than that, I expect one word.
communication
Understanding
skill.
the documentation.
Yes, someone said communication. Yes, communication skill. I want to discuss something other than that. I can able to understand the languages of Tamil, English, Malayalam, Hindi, Telugu as well. So you can able to talk in your own language. I can able to understand. I can able to deliver in English. Okay, so Tamil, English, Malayalam, Telugu, you can able to talk. Okay, so no issues. Language doesn't matter in the training, but if you want to become a coder, compulsory communication skill is required. Communication skill means like how to read the documentation. How to read the documentation. Why I'm saying simply I'm saying that even though if you are going to the normal clinic, if the physician writes the prescription, now the terms was changed, but before itself, if the physician writes anything else, except that pharmacist, we can able to understand anything. Even though if it is paracetamol, we can able to understand the terms. Physician language.
No, sir. No.
Yes, quite common. Even though if it is a paracetamol, even though if it is a tablet name, we know that, but even though we can't able to understand that the physician language means physician writings. But in medical coding, what we are going to do? Medical coding, what we are going to do? We are going to be reading the complete physician documentation. Yes, complete physician documentation.
To read the complete
Yes,
physician
scenarios.
documentation.
So now think like that, how much knowledge we need for the communication. How much knowledge we need for the communication. Now you can understand why it is more required for the communication skill or how to understanding the thing. Because for our own language itself, if we are saying something else, some other people are thinking it is different. If our own language, we are talking with our friends also, we say something else, but he will think like in the different format, right? But if you are going to be reading the English by the physician language, if we think something else, what will happen? Complete revenue was collapsed. Complete revenue was collapsed. Okay, so that is the thing. You need to be understand about the basic communication skill. English knowledge mandatory. In particularly inpatient visit, compulsory English knowledge is mandatory. Why I'm saying everything here now? If you are going to choose your career as an inpatient coder, you should know the positives as well as negatives. My people, my friend is working in inpatient coding. He is getting 80K salary. He is getting 90K salary. Yes, he will get. He put an effort. So the same effort, if we are putting, we will get. But if you are thinking he get only the salary, I'm also get. I will get it now. You should put on a effort. So that's what I'm recommending. Ipdrg is not for everyone. First, you should think like that. Inpatient coding is not for everyone. Not for everyone means you don't have any commitments in your life. If the thing is, I'm able to enter into the coding, whatever the specialty is fine. I can able to work peacefully. Means don't choose Ipdrg. I would like to recommend don't choose Ipdrg because Ipdrg is very difficult, very critical in first 6 months. In your office, you will think like that. Why I joined Ipdrg like that? You will get on a stress on that. But later, when you are getting that more amount of salary, at the time the stress will go. That is different. Correct. When we are getting like 60K, 70K salary, our stress will go out. But at the time of situation, it is very difficult. So if you're having a lot of commitment, you want to go more, grow more means compulsory Ipdrg is one of the specialty for the life science graduate. Because if you are a life science graduate, you can't able to go anywhere. No other companies are ready to pay that much salary. If you are ready to go, like for example, you done B Pharm, M Pharm, MPhil, PhD, whatever it is, no one ready to give you within the 3 years 1 lakh. Any one of the people are ready to give you 1 lakh within the 3 months. Sorry, 3 years. Any one of that. If you are going as a professor also, it will take around 10 years.
No,
If you are
sir,
going the
no other
research, research also, it is very difficult because
Mm.
life science graduates having less vacancies. Less vacancies means less departments to work in IT department. This is the only scope. And I would like to recommend one of the biggest companies going to be launched in Hyderabad. I hope you people are seen in the newspaper in the last month, right? Global Health. Aware of that? Yes, no. 4,000 employees they are going to be hiring for Ipdrg. Yes. Yes.
Company?
Global Health going to be hiring for Global HCA. They are going to be hiring more than 3,000 coders only for experienced candidate. They are ready to pay more than lakh per month. More than lakh per month. They are ready to planning to hire. It's the process is going on. Don't know how much salary because it's not a company. They're having the hospitals. They having the projects. So they will pay. They will pay. So they have their own projects only for Ipdrg, inpatient coding. Those projects nowadays another companies are doing. Lot of another companies are doing their projects when they come and they are opening in Hyderabad. Open Hyderabad in that IKEA is there, right? And IKEA opposite they are planning to open in that building office. The construction is going on. So this is the thing is happening there in the boom. The market is right now boom. This is the right time to start. That's what I'm saying, that this is the right time to start and enter into the medical coding in inpatient specialty. They are planning to pay around more than 1 lakh within the 2 years experience candidate. We hear that in the meeting, they are ready to pay more within the 2 years experience candidate for an inpatient coders, not for other specialty. That is specifically doing only in the inpatient specialties. So they're ready to pay that. We hear a lot of things in that, like rumors in the market, and we are here that I'm not sure about that, how much it is correct, but exactly it's not about 1 lakh, but compulsory they will pay 80,000 per candidate per month for the 2 years experience candidate. Even though other people are getting 60K within the 2 years experience candidate, we are placing more candidates in our institute. So this is the boom in inpatient coding. If you are a life science graduate, there is no other options. If you are already working in a HCC department, if you are already working in a ED department, you people knows very well, correct? If you are working in HCC ED department, after 2 years, how much salary you got? 35,000. HCC department, it is very less, 30,000. HCC department is very critical. Nowadays, AI was entered into HCC. The people are removing the candidate. Correct? The people are introduced new kind of software that is in HCC. They are coding everything. Only nowadays, auditors they are hiring. Correct? HCC coders.
Yeah, yes, it's correct.
Think like that. HCC as of now, it is a critical situation due to AI. They are invented one of the software. That software is doing the coding right now. Only they are hiring the auditors who is having more than 5 years experience. There is no coders moving forward. Already radiology gone. Everyone knows about that, right? Already radiology coders, pharmacology coders, pathology coders, anesthesia coders, all are gone. Why they gone? How it is happened?
So what about
So why anesthesia code?
Yes,
Why
it's
anesthesia
gone.
code has been gone, sir? Why?
It's
Sir, I'm asking you, sir. That's I know about that.
Yeah,
I haven't about that, sir. So I want to know about from your side, sir.
because
Why they want
anesthesia coding, which is combined with the surgeries right now. Surgery coders are doing with that anesthesia. Inpatient coders are right now combined with that anesthesia coding they are doing right now. Before that, inpatient coders or surgery coders, they won't do anesthesia. But nowadays, both the people are doing anesthesia because the software was clubbed with that. CAC integrated 3M. Aware of that CAC integrated 3M?
No.
Yes. Nowadays, CAC integrated 3Ms are introduced and they are included all the things. It was combined and it will be suggesting the codings and it will be asking to do the coders itself to do the anesthesia coding right now. Same like that. Radiology things, completely AI related. AI giving the left chest X-ray. All the X-rays codes or CPT codes are done. Only the auditors are validating the codes, whether it is correct or wrong. Precision and recall format. This is called precision and recall format. I will be explaining you during the sessions. What is precision recall, what is 3M, how the CAC is working. That under I will be explaining you later. So like that, it is happening there. Already AI coded the documentation. Now the people are doing, yes, it is correct, it is wrong. Right now it is going on. So before, what is the volume that anesthesia coders are doing? Now what is the volume the anesthesia coders are doing right now? I'm correct?
So I want to ask you something.
Yes, please.
So if somebody is holding the anesthesia coding experience, now you are just saying the anesthesia code has been gone. So now this moment who has the anesthesia code in, what should he do? What should
No, I'm saying about the market is going in the different dimension. That's what I'm saying. Different dimension.
So no, sir. Okay. Because like somebody is holding an anesthesia experience and you are asking the surgery code and anesthesia code. The software put them together. Am I correct, sir?
Yes, exactly.
So if I am holding the experience as an anesthesia coder, so if I am entering the surgery coder, it is facing a difficulty for me.
Yes. Yes. It's making the difficulty. So that's what they people are doing right now. They people are taking some cross trainings or upskill training. And apart from that, if you are working in the same company, that companies are offers you for the upskill training. Correct? The companies offers you for the upskill training to upgrade yourself. Why their company offers upgrade yourself? Because they need to be perform well and it going to be combined or it going to be developed. That is the reason the company itself offering that upskill training. 3 more companies are offering the upskill training. I'm not able to discuss the company names here in the open forum. And during the sessions, when I'm going to take only for our candidates, at that time I will be discussing the company names and how the formats are working and all everything. We'll discuss. That is no issues. Okay. So later we'll come up with that, like enter into the again category. So that is the reason most of the people are planning to upskill their end. If you are a fresher or experienced, you people need to be choose the correct section. You people need to be choose the correct criteria, correct department. You people need to be work on that, choosing the specialty. If you are working in ED, E&M, HCC, whatever the thing, you can able to shift into upskill. Whatever it is, wherever you are working there, you need to upskill your training or upskill your certifications, upskill your department. So if you are going to be upskill yourself, it should be perfect. Already you joined or already you are a fresher. If you want to enter into first step, it should be perfect. It should be perfect. So that's what I'm saying. As of now, in this medical coding market, Ipdrg is one of the better specialty to earn more, grow more. Ipdrg is one of the better specialty, earn and grow. Both it will be available. Because I started my career in Ipdrg, but at the time of situation, we don't know what is Ipdrg and this much growth will be there. We are also don't know. And we thought like any other coding is fine for us. Like that, we thought and we entered into that. But later, some people said that Ipdrg, which is more important and you can able to grow more. I thought it is very difficult, but later we entered into that thing. We selected into that Ipdrg and they given that 6-month training for us. And after that, only they entered into the project. And in the project, we get 3 months training. So total 9 months they given only for the training for to know about the Ipdrg. But as of now, the companies are hiring certified candidates and apart from the trained candidates, certified candidates and the trained candidates. Why they are making like this? Freshers, you people knows very well about why they are not taking the freshers for Ipdrg candidate. That is one question is there. And apart from that, for the experienced people, if you want to shift into one to another specialty, there is some follow-ups is there to enter into the Ipdrg. So that and all tips and tricks are there that we will be discussed during the sessions. So first of all, I will be explained why they are not hiring a freshers in the inpatient coding right now. Right now, before they are hiring, but right now they are hiring less amount of coders as a freshers. What is the reason means? Before, the people are not ready to do the certification. The people are not ready to do the training. And so that is the reason the company is giving training, 6-month training or 7-month training or 3 months training, whatever they did. And after that, they are taking into the project. But later, after COVID, what happened? Everyone are completed their certifications. Everyone are completed their certifications due to this work from home option. After work from home only, it was boom. The companies are policies are a lot of change. So the work from home was came. The work from home, due to the work from home, the lot of people are doing that certifications and after enter into the medical coding department. So the companies are changing their policy. If I want to hire the candidate, he should be certified. That is the reason they changed. Before non-certified people, they will hire. The certification sponsorship will be provided by the company. I completed my certification by the company only. They provided the sponsorship. But later what happened? You people need to be do the certification by your own. And after certification, lot of people came into the market. So they decided, okay, lot of people came. Better we can able to choose what is a specialty trained candidate I can take. For example, I'm having one company. I'm having ED project and ED project and surgery project. If the people came, everyone are certified. I need to filter. Before I don't have any filtration. Later I have a filter. Okay, you know ED or you know surgery. I will take the candidate. If I have a IP project, I will ask you if you know IP, I will hire you. So the specialty trainings are started that time only. That time only 2 years back only it was started by the companies. And later what they happened due to the financial crisis, the companies are stopped for the trainings for the freshers trainings. Because if I have a company or you have a company, if you want to run the company, you are hiring like 100 freshers, minimum salary of 10K. How much for 100 people? 10K salary, 100 people, how much salary? Simple calculation, please. 10,000 rupees salary, 100 people I hired as a fresher. How much I need to pay per month to them?
1 CR.
10 lakh.
10 lakhs.
1 lakh.
100 candidates.
10 lakh, sir.
10 lakhs, sir.
10 lakhs I need to spend. I need to give 6-month training. How much I need to spend? 60 lakhs.
60.
60 lakhs. One of the trainer is there. The trainer salary is more than 1 lakh. Around like 6 months, 6 lakhs, 66 lakhs. Apart from the DSI, PEF, everything is there. It comes under around 10 lakhs, 70 lakhs. After that, you need to enter into the project. Once you entered into the project, you won't start the complete production. There is a production scale is there. Ramp up period is there. Ramp up period is around 2 to 3 months. So in the 2 to 3 months, you won't do the target. Your target will be audited by auditors. So you won't generate any revenue up to 8 months. You won't generate any revenue up to 8 months. I need to pay for you around 1 crore. I need to spend for 100 candidates. If you have a company, already trained candidate is there, already certified candidate is there, you will given a preference to that candidate or ready to hire the trainees. What you will do if you have a companies? If you people have a company, what you will do? Already trained certified candidates are there. You will hire those people, or otherwise you will know I will take freshers and I will give you the training. Like that you will do. What you will do? If you are a hiring manager, you are investing your company, what you will do?
Sir, if we hiring the fresher people, sir, they're asking the more salary. And if you hiring the fresher people, we can provide them less
I'm saying
salary
that same
as
like
well
that
as training.
freshers, but certified and trained. By like that certified and trained. Like that candidates are there.
Trained people.
Trained people. This is the thing is happen. After that, this is the thing is happen. You know, lot of companies are hiring right now in this basis only. We are signed the 3 companies contract for only trained candidates. Before the companies are opening with the open forum of the interviews, but after the signing of that, they close the open interviews. They are hiring only from our end. Around more than 200 candidates are they hired from our end because the time is less. They are ready to pay for the extra training for us and they are giving the concentration on the training and we don't have any fear about that they will left out from the company, right? We don't have any fear. And after that they joined in the company, they don't have any training. Directly they are entered into the production within 2 months of project specification training. Even though after completed our training also, the company will provide you 2 months of project specification training. So total 6 months, they are saving that. 6 months, they are saving that. This is the issue. The freshers are not getting the hiring in the inpatient coding. This is the issue has happened. So that is the thing is they are expecting to getting into the training. This is for freshers. Experience. The issue is already you people are trained in other already working in other specialties. You are having great exposure in that. And later, due to the salary issue or career issue, ED and people are getting the auditor position. How long it will take? You people can say that. ED and people, how long it will take to get an auditor position in the same company?
3 to 4 years.
4 years. But thinking like Ipdrg coders, how long it will take to get an auditor position? How long it will take an auditor position to get an inpatient coders? Anyone? Idea?
7 to 8 years.
7 to 8 years.
1 to 2 years.
5 years. Minimum 2 years. Within the 2 years, they can able to hire. I hope you people can able to see the lot of messages in the group, WhatsApp group, Telegram group. You people seen that, right? You people seen that only 2 years experience is enough for auditor position. We are ready to hire. If you have 2 years position, okay, you can apply for a QA position because there is a lack of audits. At the same time, it makes large amount of revenue to handle. We are handling large amount of revenue in inpatient coding. So simply one calculation is there. One of the outpatient specialty is there. 100 people came to the consultation, each people paying 500 rupees. How much they will earn? 100 people is there. 100 people came for a consultation, each people paying 500 rupees per day. I mean, per visit consultation. One physician can able to see maximum 100 people. 2 physician can able to see 100 people. How much they can able to generate in outpatient visit? 50,000.
50,000.
Only 50,000. Not 5 lakhs. 500. 50,000.
50,000.
It is maximum 2 physicians can able to handle 100 consultations only. Correct? If a physician is 2 physicians can able to handle 100 physicians. Maximum they can able to generate only 50,000. Right? But inpatient visit, I can able to do only one CABG surgery, like cardiac bypass surgery. Only one cardiac bypass surgery. Maximum 3 to 4 physicians will be involved. One anesthesia, one cardio, one vascular. Like the total 4 people will be involving that procedure. What is the charges for cardiac bypass procedure as of nowadays? Only one CABG.
3 to 4 lakh.
How much they need to pay? User need to pay for that fee.
6 to 7 lakh.
6 to 7 lakhs. Minimum 5 lakhs.
7 lakh.
Yeah, minimum 5 lakhs, right? It depends upon the hospital. It will be vary that we don't want to go. But even though wherever you are going there, minimum 5 lakhs the user need to spend. Think like that. I'm doing only for with the 4 physicians within the 4 hours procedure. CABG maximum 4 to 8 hours procedures. 3 to 6 hours procedure is a CABG procedure. Not more than that it won't do. So 3 to 6 hours procedure, I can earn 5 lakhs. But here I seen 100 people, 2 physicians, I earn able to only 50,000. Think like the revenue difference. So the same concept, why the outpatient coders are getting less salary, how the inpatient coders are getting the salary high. That is the difference. Outpatient coders are working with the large volumes and they are making the revenues less, but inpatient coders are working with the less volume, but making the revenue was high. What is the outpatient target of HCC?
Sir, in profiler, 150. And in medical coding,
Okay,
Based on
ED&M.
company,
ED&M, what is the target for ED&M?
80 to 120.
80 to 120 per day. What is the inpatient coders target?
15 to 25, I think.
Maximum
10 to
15 to
60.
20, not
25
25. 25
hours
is very rare scenario. Still, I didn't reach my
10 to
target of
15.
25. Maximum
Yes, sir.
15 to 20.
It
That
is
is the
18 to 20.
yes, 18 to 20. That is the average target for all the companies. One time my company was increased up to 22. Our quality drops up to 85. Suddenly they changed into 16. So it's happened there. So just I'm saying that. So this is the thing is there. I'm doing only for 15 charts, but I'm earning 1.5 lakh or 1 lakh. 1 lakh as a coder, 1 lakh is there. For outpatient coders are doing like 120 charts, but they are able to earn like 50 to 60,000. That is the difference in the inpatient coding and the outpatient coding. Then you can ask, sir, why they are paying? We are also working with the same ICD, same CPT codes, and inpatient coders are working with same ICD and PCS codes. Why they are paying more? Because outpatient specialty, if you are knowing that ED and ENM, you people are going to be working with the limited codes, limited CPTs, limited things. Surgeries also, if you are a surgery coder, if you are a urology coder or cardiology coder, you are working with some limited CPTs. But inpatient coders, it's not like that. Inpatient coders knows everything. Knows everything means they should know everything. I'm not saying that everyone knows everything. I'm saying just they should know everything, because in the 18 to 20 target, the people are doing infectious charts, the people are doing orthopedic charts, the people are doing obstetric charts, the people are doing pediatric charts, psychiatric chart, cardiology, neurology, all the related surgeries. There is no specific cardiology Ipdrg coder, and there is no orthopedic Ipdrg coder. Nothing is there. Each and every coder need to do everything. All the coders need to do everything. That is the reason they are paying more. So you should not say, I don't know what is that infectious. I don't know what is orthopedic. I don't know what is the bone category. I don't know what is that bipolar disorder. Not like that. Ipdrg coders should do all the surgeries, all the ICD related codes. We people are handling all the ICD and PCS codes. We people are doing all the things. Each and every inpatient having one surgery. At least just PICC line also they will place IV line. Just if the patient admitted, compulsory they have IV line. One procedure will be there. So that is the reason the inpatient coders are getting high salary and outpatient coders are getting less salary. That is the difference. I'm not degrading that specialty. I'm saying that salary, because as of now, wherever you are going, even though if you are going to fix your marriage also, the first question they are asking, what is your salary? It is 6-digit or 5-digit. Yes or no? Because some of the candidates are came, sir, I'm fixing my marriage. At least I need to go for a 6-digit salary, or otherwise they won't give you that much of something else, right? So I'm saying about the reality. Yes or no?
100%, that is correct. That is
It is a
correct.
reality right now.
Yes,
Correct?
100%. 100%.
Yes, that
But
is a
nowadays
reality.
only they are asking only the 6-digit number only. 5-digit nothing is possible.
No, directly they ask, sir, as of now, I'm getting 60K salary, sir. Even though 60K salary, they are saying not enough.
Yes, correct.
What we should do? There is no other options. You should do shift into Ipdrg. That is the only option. There is no other thing. Ipdrg means if you have a CCA certification, we can able to get it 40%, right? 40 to 45%, right? If you are having CPC certification, 30 to 25 to 30% high. That is the difference. I'm saying before one of the user asked, I'm having CPC certification, what I should do? What is the difference between means both the certification is eligible, but the hike difference is slight difference will be. For example, if you are a CPC certified, you will get max to max 30% hike. If you are a CCA certification, max to max 45% hike. That is the difference. Clear? There is nothing is there. I'm having CPC. I won't get job like that. Not like that. You will get, but the salary hike will be different. Got it, team? That is a difference. Other than that, there is no differences there. Okay. So
I have one doubt. In only science background persons only doing like Ipdrg, or other non-science background
two things
persons
is there, ma. For example, if you are a fresher, compulsory you should have a license graduate. If you are a fresher, but if you have started your career in already 2 years back, you are in the medical coding field, but you are a non-licensed graduate, you have a certification of CPC or CCS, you can cross-train and upskill yourself.
Okay, thank you.
As of now, this is the situation. Before, everyone can do, if you have a CCS certification, you can enter into the Ipdrg. But right now, they have a lot of restrictions. What happened last batch, one of the candidate came from non-life science. He cleared the CCS with good percentage. He scored 356 score. But he done the interview well. But the company says, our project is unable to take you. He cleared the interview actually. One of the biggest company, he cleared the interview. We sent 50 people, only 17 people got selected. He got selected. But the end of the day, the HR manager was said that project is not suitable for your profile. Your profile is not suitable for the project. So I would like to recommend, I don't want to waste time of non-licensed graduate if you are a fresher. If you are a fresher, if you are a non-licensed graduate, I would like to give you some other jobs like medical billing. We are giving the medical billing training as well. So I would like to suggest like medical billing thing. Later, you can shift into your career Ipdrg or some other specialty. If you are already working with medical coding department, you are entered, you are having certification, you can do. There is no issues. It's clear, team?
Yes, yes.
Okay.
Yes, thank you.
So this is the basic thing is there. Next, I will be come up with that AI, right? AI, artificial intelligence. It's going to be demolish medical coding or not? Yes or no? As per your opinion, what you people are thinking? What you people think that?
No, sir.
Yes.
Not almost,
Not
but
completely. Not
from the
completely, sir.
50% only.
is not done like.
Okay. Actually, what is the issue happened there? There is a two things is there. I told you, right? Inpatient specialty and outpatient specialty. Outpatient specialty, they reached that accuracy of 95%. 90%, sorry, 90% accuracy they reached already in outpatient specialties for the AI. For the AI. For example, if you are doing 100 chart, you need to do 200 chart. You need to do 200 chart because half of the coding already done by AI. You need to evaluate. So your target will be increased. Your job won't be go. You will be there in the company, but your target will be increased. Correct? Your target will be increased. Second, I will be come up with that inpatient coding. Inpatient coding, as of now, when I started my career, at the time itself, there is a software are there that is called Fusion. Right now, we are called at CAC. Before the name is called Fusion. At the time itself, only for 40%. Now the AI came into that after 8 years, increased only for 20%. Still the quality is only for 60%. Still the quality is for 60%, 60% only the accuracy. So simply I will give you one calculation. One surgery was performed, the charges is 1 lakh. 60% only error, that AI will be given you correct means how much the hospital revenue will get it. If total hospital revenue is 10 lakhs, but that due to completely I hand over to AI, how much revenue they will get?
Only 60.
6 lakh.
Only 6 lakhs. 4 lakhs will be go for a AI error. 4 lakhs will be go for a AI error. Anyone will agree?
No, no.
But if I'm working with outpatient department, total 10 lakhs revenue, but 90% accuracy is there. How much the hospital will get?
Only
9
one.
lakhs. 9 lakhs they will get. Only 1 lakh the error will be. Only 1 lakh error may happen. If I have that 1 lakh I can able to manipulate with that employees.
Yes.
Correct?
Yes.
1 lakh
Correct.
error is fine, no issues. I will be manipulate and I will be reduce my employees. I will be sort out that 1 lakh. This is the issue is happen. Right now, the market is like that only. I'm open-minded. I'm saying everything because I'm working from the low level to high level. Still, I'm giving the lot of consultancies and whoever ready to open the medical coding companies, I'm giving the consultants also doing that. So we know what is happening there and what it is going there and what is the thing is next thing. I'm having an idea about that. I'm not saying that I know everything. I'm saying I'm having an idea about in the future. That's what I'm saying that. So now you got it, the difference between AI, how it will be impact. When it inpatient coding reached 95% of the quality, at the time it will be done, but it will take more than 20 years. It will take more than 20 years to come because it's not possible because lot of rules we are following in inpatient coding. That and all tomorrow I will be discuss why AI is not in came under into the things and all I will be discussing later. So as of now, this is the basics things of AI. AI won't enter into the inpatient coding. It will be there. It will be increasing your target. It will be assist you. It will be giving you the guidance, but it won't be replace you. It's not possible, first of all. It's not at all possible. How it is not possible and all everything, I will be open one of the software and I will be showing you, you can able to understand better way. You can able to understand better way. So this is the basic things. What is Ipdrg? What is outpatient? What is inpatient? How it was designed, the structure and all everything I explained right now. And next thing is finally, I will come up with that. Why we need to choose us. Everyone are giving Ipdrg training. Everyone are giving everything. Why we need to choose AGS coding, Tech or AGS Healthcare Private Limited? Why we need to choose us? You know about when we have started our career, we didn't do any other trainings of surgery or we didn't do any training. We did only for Ipdrg training. If you go any other institute, they will do a lot of training, ED training, E&M training, surgery training, and denial training, CPC training, CCS training, everything they will do. But when we started before 3 years, we started only with a particular Ipdrg training. We growed. Later, we started CCS certification training. We growed more. And later, still, we are concentrating only for the Ipdrg training, only the CCS certification training. But we are having more candidates. We are having more candidates. So the meaning is the growth is in Ipdrg. whatever giving multiple trainings to some other institutes, those people are getting only for less amount of candidates, but we are doing only for Ipdrg, we are getting more number of candidates due to the standard. And one more thing, there is no specific trainers are not available in the market. Why the specific trainers are not available in the market means I'm already earning 1.5 lakh. I'm ready to give the training for you and others. It is required to me. Already I'm having 5 years to 6 years experience. I'm earning 1.5 lakh. Already Ipdrg is a headache work. I'm already working in the company. It is headache work for me. No other institutes will give you 1.5 lakh for the trainers. That is, you people knows very well. So I'm not going to join as a trainer for the institutions. They won't give you 1.5 lakh. I will work with my company. Already it will take more burden to me, and I completed my work. Again, I need to spend some time to the students to take the training. If any one of the people will think like if you become Ipdrg coder, it is possible.
No, it's not possible.
As per the mentality, because Ipdrg is burden. Already you spend more time with the charts, and again you won't spend some time to the students to give a training. It's not required. Already I'm getting more money. Already I'm getting 1.5 lakh. Why I need to spend about Saturday, Sunday, Monday, Tuesday, everything? Why I need to spend more time with this? Not required. No need. So that is the reason the thing is comes under into that. There is no specific trainers. If the trainer is there also, they know only from the theoretically. They know what is ICD. They know what is PCS. They know how the live chart is, but they don't know about the software navigations. They know about the real-time experience. The main thing is real-time experience needed when we are going to do the training. If it is very easy to explain what is AIDS, what is beat, what is HIV, but there is a lot of differences there if you are going to see the documentation. How the physician says it is HIV. If you are asked any one of the trainer, they won't say. How the physician says HIV converts to AIDS. The trainers don't know. The trainers knows AIDS code is B20, HIV code is Z21. But how that Z21 converted into B20, when it will be convert, how it will be convert, what is the medication for that, what are all the types of medications are there, how the physician identify this is. Lot of things is there. So here
CD4 count will calculate, right?
Yes, that is a CD4 count. So CD4 count, how they are checking and how to find out from the past medical histories. So lot of things are there. So that and all here we people are going to be learn that during this. So before going to be showing you just a schedule copy, I will be sharing you the schedule copies also. So here we stretched our training schedule. Before there is a training will be given 45 to 60 days. Now we are planning to given the 45 to 60 classes. The difference is there. 45 to 60 days means 2 months. But 45 to 60 classes means it will be come up with 3 months. It will be come up with 3 months. If you think it is very long duration. Last up to December itself, we take only for the two months training and 2.5 month training only. But after that, from this new year 2026, we redefined our training. Completely, we redefined our training, and we are introduced our AI softwares also. You can able to ask the codes, things and all. Tomorrow I will be showing you the demo of the softwares as well. Everything we defined 45 to 60 classes, not from the days. Means 3 months you people have the training. 3 months we people have the training. First month basic thing. Even though if you are an experienced candidate, before we thought like experienced candidates, we don't want anatomy. We are reduced like ICD classes. We can elaborate PCS classes like that we thought. But end of the day, only we knows that the people having an idea about ICD, but they don't have an idea about how it is working in the inpatient specialty. Simple thing. Outpatient coders are there or freshers are there. For outpatient coders, I'm asking possible conditions can be coded from the documentation. Possible conditions can be coded.
No,
but
not
inpatient code we will code. But inpatient we will code.
Yes.
Inpatient. So the simple things are, even though if you know ICD guidelines, but when you entered into inpatient coding, it's completely different. Some people will say like, it is like that, but it's completely different. It's completely different what their expectations. It's completely different. So right now we started our training completely 3 months. Even though wherever you will go, the companies, the training institutes will say 1 month it is enough, 2 months it is enough, 3 months it is enough. 2 months is enough. I'm damn sure I'm saying that it's not at all possible to learn the basic things also within the 2 months. So here we started, even though if you are experienced or fresher, we are going to be start this from the scratch from anatomy and physiology. We are going to be given you the best training in the market. So we are elaborated our training schedule. Why means the companies are hiring from us. If the people are saying like the people don't know anatomy and physiology. Last time we sent one of the company for the 60 candidates. They said that they're strong in ICD. They don't know anatomy and physiology. How I can able to talk with that? You can ask me again, candidates. That CEOs ask, I seen your candidate, I evaluated your candidate. They are knowing ICD, but they when we ask anatomy and physiology, they are lagging that anatomy and physiology. What we should do? They said that, sir, there is, it depends upon the users wise. But we redesign. That is a scale thing is we redesign that. And one of the biggest company we are giving the tie-up with the corporate trainings. We are giving the corporate training for the multiple companies in Hyderabad and Coimbatore locations. That company was said that the people are aware of the guidelines, but they don't know about the basics. This is the reality happened. They know the guidelines of ICDs and PCS and all. They don't know the basics. Basics means anatomy and physiology, medical terminology, which condition, which medication, which condition, which is the symptom. They don't know that. If I ask what is excluded, what is excluded, they are saying. But how it was there, why it's not coded like that, the basic concept of they don't know. So we redefine completely to our training schedule for 45 days to, it is very high. It is very high. It is very high means one trainer going to be accommodated for 3 months means it's think like that. How much time you are going to be with us? No other institute will do like this kind of 3 months dedication for one batch. We won't get that much revenue on them. We are going to be giving the dedication for you because the trained candidate should go outside with better knowledge, with a better knowledge from our institute. Because how we are getting the contract, our candidates are trained and going there and they people are saying, I trained here. Okay, you are doing well. Call your training team. So we connected with the company. They said that you given the good candidate and we are want to connect with you. Like that only we grow more. If I didn't deliver the proper candidate, I can't able to grow more. Correct? If I didn't given the good candidate to outside, how I can grow? Now we are doing one of the company projects as well. One of the company called us, we delivered around 100 candidates to them for the freshers. They given us the contract and we are doing their half of the project. They don't have that much manpower. We are doing half of the project with them. How it is possible? Because we delivered good candidate. We delivered good candidate. That is the reason. Lot of institutes are there. Wherever you will go, Ipdrg max to max, they won't give you that much of duration, that much of materials also they won't be provide you. We have around that more than 1,000 charts. We have more than 1,000 charts. We have 2,000 MCQs are there. Written assessments are there. Interview pattern we created like a assessment basis. Everything we are providing that. So I will be just simply I will going to explain about the schedule, how it was designed. First 5 days, you people are going to be learn the basic learnings. First 5 days, you people are going to be learn about the basics of anatomy and physiology and how it is there and how it is working. What is a system? Anatomy physiology means I'm not going to be take like it is stomach, it is duodenum, not like that. I'm not going to be explained like that. I'm going to be explained the anatomy physiology. If heart function is there, in heart, what is the complication happen? Heart failure. What is the treatment for heart failure? IV Lasix. If the patient having sick sinus syndrome, what is sick sinus syndrome? What is the treatment for sick sinus syndrome? Pacemaker. This is the way we are going to be learn in the anatomy and physiology. It's not a normal anatomy and physiology. Don't think like that, like anatomy physiology means left side stomach is there, right side, this thing is there. No, not like that. Here we are going to be discuss about completely related to the what is the system, what is the complications happen in the system. If the complications happen, how the physicians are treating the systems. That is the thing. Got it? You people can understand how it was designed. Clear?
Yes.
This is the thing
Yes.
because that is the basic. If I'm saying digestive system now, your mind should become what are all the procedures are performed in digestive system. You should not think like digestive system is stomach, duodenum, jejunum. No, you should not think like that. In the digestive system, colectomy may perform, colostomy may perform, pancreatectomy may perform, gastrojejunostomy may perform. Like that, we are going to be preparing you. What is Crohn's disease? What is ulcer? What is Graham patch? Like that, we are planning to discuss. Got it? So it may be used. It will be useful for whenever I'm going to take a ICD 10 CM. Directly, if I go to the guidelines, there is no use of that. There is no use of that. You people will see something else. You people work something else. Okay. So next thing is I'm going to be see about the advanced learning. Advanced learning is comes under ICD guidelines. Here we are going to be discuss about complete in ICD guidelines, which is inpatient topics included. Next thing is ICD 10 PCS, procedural coding systems. After procedural coding systems, we have a live chat sessions. Here didn't mention there. In the live chat session, we are going to be discussed. In the live chat session, we are going to be use the multiple tools, AI tools, 3M softwares, and I'm going to be giving you one of the Clintegrity tool as well. You people are going to be working with the Clintegrity tools. That Clintegrity tool, it will be more useful to work on the companies as well. Whatever the companies are not having 3M, those companies are working with the Clintegrity tool. Hyderabad itself, 3 bigger companies are working with the Clintegrity tool. That tool you will get it. And later interview preparations, individually interview preparations will be there. And apart from that, how to prepare your resumes, how to make the interview arrangements and all, everything we will do. So it will take more than 45 to 60 classes it takes. So due to this thing, we are redefined as fee also. Before we are charging like the fee, you need to pay complete fee. But now we redefine the fee. The total fee is comes under around 15,000. You can pay each and every month 5,000, 5,000, 5,000. No need to pay everything completely here. That is the thing we are decided. So if I'm going to be asking complete, you can pay the fee. It's very difficult to for everyone. We are ready to give you better training. The same thing is charges will be there, but the people also need to pay, right? The people also need to spend some amount. If I'm asking completely, you need to pay that amount. It's very difficult. So you can pay 5,000, 5,000, 5,000. Initially, you can pay 5,000, and after next month, you can pay 5,000, and after next month starting, you can able to pay 5,000. So total 15,000, your fee will be there. In case in between you are unable to pay the fee, that you will be removed from the training, and your access will be lapsed. That is the thing. So there is no nothing will be. The terms and conditions are you can pay only 5,000 for initially, and next month 5,000, next month 5,000. So total fee is 15,000. This was designed from our end. Okay, so you will get better thing, and the mobile application access and the live chat access before we given that like 6 months. Now we are extended up to 1 year because 3 months itself training. Later 3 months, it will take some time to practice. After that, only you people are going to be working into the companies now. If you are working with the companies also, you need some references. Correct? If you are joined the companies also, you need some references to learn that. Whatever you know, if you've seen the PDF, you will get some idea. The recordings will be there. Whatever the classes we are taken, it will be recorded and it will be uploaded. So we are decided for the people to getting into the 1 year access. Got it, Tim? 1 year, you will get complete access. Recording sessions, live chat sessions. At the same time, it will be uploaded. Whatever the classes we are getting, that new updates. For example, if you are taking 2026 guidelines, again October you will get 2027 guidelines. That guidelines updates up to 1 year. For example, if you are joined January 5th or 6th, the next last classes will be comes under around next January 5th itself. What are all the classes for the live chat, not ICD pieces, live chat, this under all be taken, it will be uploaded there. You will get around more than 4 live class sessions. Means 4 live class sessions means you will get 1 live class, next batch, next batch, next batch. So you will get these kind of benefits. You will get more exposure. Everything you hear, you people can able to get it. It's clear, team? It's clear?
Yes, sir.
Okay.
Yes,
So
it's
as
clear.
of now, I will be hold my session, and tomorrow I can able to discuss with you regarding that more. What is inpatient? Now I clarified you what is benefits of inpatient coding, and you can choose inpatient coding or not based on your preference. I given the descriptions. Tomorrow I'm going to giving you the more explanation about like what is inpatient, how to learn the inpatient, and inpatient itself lot of specialties are there, how to know the specialties and why these kind of specialties are there. Tomorrow we are going to be discuss that. Same link, same timing 8:30 p.m. You can join there, and whoever needs the application access, please mention this format mark. I will be sharing one format. Please mention this format in the chat box itself. So you people will receive a message. Normal text message you will receive. You
So
will
when
receive.
are classes
Yes, ma'am.
started?
These 3 days is a demo sessions, ma. These 3 days you don't want to pay anything else. Okay. These 3 days you can observe there and how the classes are going on, how the things are going on. From Monday onwards, regular class. Actually, this is the classes. It's a classes. It's not a demo. It's a direct classes we started. So from tomorrow onwards, the classes will start. Okay, you can continue the session. And Monday onwards, paid classes. From Monday onwards, paid classes will start. Yes, please.
How much amount, sir? Total training total 10,000 per month, 10,000 you are saying.
Okay, I'm not able to hear clearly. I shared one full name, mobile
Somebody
number, mail
told
ID.
me 10,000.
I'm not understanding.
You are saying per month. You are saying per
Somebody
month
told
10,000. These are total training, total 10,000, sir.
Total?
You are saying fees per month 10,000 or total training from
Total fee is
10,000.
15,000, ma. Total fee is 15,000. Per month, you need to pay 5,000, 5,000, 5,000. The training duration is 3 months.
Hello.
Yes, please.
So, Ipdrg mostly hiring the life science graduate.
Yes, exactly.
So, may I know the which life science graduate are required for that?
All the licensed graduates like microbiology, BSc physics, BSc chemistry, everything they will hire. BSc is they will hire.
So, I had.
BSc
So,
max
what
they
about
won't
the
hire.
pharmacy?
BSc they will hire.
So, I had done diploma in pharmacy as well, bachelor in pharmacy.
Then that is fine.
Okay, so that's only one concern my hand.
Yeah, that is no
Let you
issues.
know.
And just a second,
Hello,
I'll
sir.
be just a second. I'll stop my recordings and whatever the concerns you can ask with me, and I will be there in it, and I will be sorted our issues, and later I can able to go there. Okay, so I will be mentioning that format just mention here, and tomorrow morning you will get one message for application link and how to use that and what is the batch that is materials and all everything we can able to see in that. Okay, so just mention you in the format itself. And just a second, I'll stop my recording. And tomorrow you people can join with the same link and the same time as well. Okay. Okay. So just a second. Okay, team.